Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we're going to get into a couple of important areas of your health, something that we all want to pay close attention to. But first, how about this? Call before you dig. What's that about? We have an expert coming on the program who's going to help us answer that question, and we'll do that in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, Terry Fitzpatrick joins me. He's the president and CEO of the Energy Association of Pennsylvania. Before that, he was a member of the Pennsylvania Utilities Commission. We call on Terry to come on and help explain all these things that matter to a lot of us. And the first thing we're going to talk about is something that's very, very important to your safety and to your welfare. Do I have that all about right?
Absolutely. Safety is important.
And it's called Call Before You Dig.
Yes.
All right.
Yes.
We're outside of our house. We have a backyard. We decide we're going to do something. We're going to put the shovel in the ground, or we're out in the front of, the front walk. We decide we're going to dig, or we have somebody we hire to come in, right? To do the dig.
Right.
It could be,
correct.
In a word, dangerous?
Sure could be.
Explain that.
Sure could be. Well, in our modern society, we have all these great services, utility services, telecommunication services. They require infrastructure. A lot of that infrastructure is buried in the vicinity of your home. So you need to be careful when you dig that you don't hit this, because it can disrupt your utility services. And of course, it can be very dangerous as well when you're talking about electric and gas lines. Now, if you're doing a little bit of digging in a garden with your shovel, it's not an issue. But anytime you're digging a trench, or especially with any kind of equipment using a backhoe, you need to call this 811, call before you dig, because
Say that again.
It's
Give that number.
811, call before you dig, because then they will have the utilities come out and mark where their lines are to make sure that you don't hit these lines when you do the excavation.
Of course, I'm chatting here with Terry Fitzpatrick. He's the president and CEO of the Energy Association, as I mentioned, also a former member of the Pennsylvania Utilities Commission.
Right.
Well, this is interesting. How common is that? Is it completely uncommon? Or, I mean, one perhaps, and I think you would agree, is too many.
Right.
One accident that's preventable is too many.
Yes. Well, unfortunately, it does happen that folks will dig and they won't call. And sometimes it can be tragic, when they hit the lines. Enforcement of that law recently was moved. In a law last year, it was moved from the Department of Labor and Industry to the PUC. So the PUC is currently in the process of implementing that.
Is that a good thing?
Well, I think we supported it because the PUC is more accustomed, I think, to dealing with these utility type issues rather than labor and industry. And the idea was to beef up enforcement and put a little more resources into that.
And we have, let's be candid about this. It's not a criticism. We have an old state. I mean, there were lots of stuff that went on decades ago, right?
Right.
And even the records may not be as complete as they should.
That's been an issue. Yes, that's been an issue. And I think our members have done all they can to try to find the records of where these facilities are so they can be properly marked.
Yeah. Now, is this something that urban, suburban, rural, is there some dimension based on geography that matters? You would think just off the top of your head that it might be more of a rural problem, but then I could see you're in the suburbs that were recently opened up for development, right?
There's probably more of an issue with locating lines in older areas and in more rural areas. But the biggest issue is folks, not calling and then digging, so that it doesn't matter if you know where your lines are, if you're not asked to mark them. And it really is. It's the biggest safety issue. It's the biggest cause of gas explosions, by the way, is when folks, don't call, 811 and go ahead and dig and hit a line.
All right, there it is, 811. This is important. All right, I want to turn to another subject called accident prevention. And there's a committee that you're involved with that. Well, first of all, what's accident prevention? What's that program about?
Well, the big picture here is that one of the major things that utilities have to do and that the PUC oversees is the safety and reliability of utility service. I often talk to you about the price of utility service, but the other aspect of it is They oversee
and we'll
our
get
safety.
into that in a minute or two. Go ahead.
Happy to do that.
Yeah,
safety and reliability. So we take safety very, very seriously in the utility industries. And as part of that, with our trade group, we have with electric and gas utilities, we have an accident prevention committee. The operating people from the different companies are on this committee, and we keep track of how the companies do in terms of their accidents, in terms of preventing injuries.
Right.
And then this committee, we give awards each year to the companies that have had the best performance, those that have improved the most. And that consists of how their fleets operate, because utilities drive a lot of trucks. How are they doing in safety on the road?
That's a great point.
As well as how are they doing with the actual facilities that they operate.
And we see the trucks all over the place. I mean, the one thing that strikes me is when you drive down a typical street and you see all these telephone poles with all of these lines, electric lines. I presume that's what they are, overhead going everywhere. And you got to wonder why more of them literally don't just come down.
Right.
I mean, just because of their age, and it's an older, I'll use the word infrastructure, whether that's the right word to use or not.
No, that's a good term, but one of the big things related to safety and reliability that we do too is there's been a big emphasis in the state, and honestly the government and the legislature and the PUC have helped us on this to be able to replace that infrastructure more quickly. Right. That has been a big point of emphasis to modernize the systems, to replace those gas lines, to put in new poles and new wires so that the system doesn't break down.
All right, we're going to run to a break. When we come back, how about this question? Are utilities going to go down? Is your gas bill and your electric bill going to go down? Terry Fitzpatrick's going to help us understand. Well, we'll find out if that will happen.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back, Terry Fitzpatrick. He's the president of the Energy Association of Pennsylvania, and that's what we're doing, talking about all things energy. Well, how about this? Are you going to get is your gas bill and your electric bill going to go down? That's why we have you here. You're going to help us understand that. All right, tell the folks out there what's going to happen. Sure.
Well, there's an issue there's been some discussion of, and the PUC actually has a proceeding on this, with the passage of the federal tax law, the Tax Cuts and Jobs Act, it was called, that reduced the corporate net income tax rate. There's been a question of whether utilities are going to immediately reduce the rates to reflect a lower tax rate. And the answer is not one that's completely clear one way or the other, because there were a lot of complex provisions in that tax law. It reduced the corporate tax rate, that's true, but they also changed a lot of rules with depreciation. So each utility is affected a little bit differently because of that. So the short answer is a lot of utilities, depending on their circumstances, if they really did have a big reduction in their tax burden, a lot of them are turning around saying we're going to flow that reduction through to customers immediately. Okay. Other utilities are saying, look, we need to have this studied a bit more, because we don't think that we're going to have any kind of a windfall when you look at the total effect of the tax law on us. So that's all being studied. There's a PUC proceeding tiring it out.
We'll get back. This is the controversial tax, quote, reform bill, end quote, that Congress passed last year.
That's correct.
And there are lots of pros and cons to it. One of the things that was debated when they talked about reducing the corporate taxes was whether any of that would get passed along to consumers.
Correct.
You're talking about one specific area. Go ahead.
Yes, we're talking about the corporate tax rate, which, other things being equal, you would think would reduce the tax burden of utilities, and that's the question. Should that be flowed through to customers? But as I'm saying to you, there were a lot of other provisions in that law, so you need to look at all of them to determine how each utility is affected, because they're all different in that respect.
So the one way that they'll know is they're just going to have to check. I mean, you think they will get notified to our viewers out there? Mm-hmm. Will they get notified specifically by their utility, or will it just show up on a bill? I mean, or could it be handled either way?
Well, I'm not sure what kind of notice is going to go in the bill, but when the PUC is done with its proceeding, all of that will be reflected in the rates, whatever the PUC decides there with regard to the rates. But as I said, some of the utilities that clearly think they're having a big reduction in their tax bill are flowing those benefits along to customers as quickly as they can get it into their billing systems.
Okay, so they get it in the bill, and the PUC's role is exactly what?
Is to oversee all of this and approve it, because they've established, what they've done at this point is they've established all the existing rates as temporary rates, so that they can go back and make a retroactive adjustment if necessary, in order to reflect what's really happening with the finances of the companies.
As you know, there were many aspects to the tax bill, to the tax reform bill, and that was one of them that was pretty big, about whether, generically, in general, whether companies that got these net corporate tax reductions would in fact pass them along to consumers.
It was, yes. That was a big political issue with it. You know, were the companies going to go out and hire people? I know that was one of the issues that was debated when that law was being considered.
You know what's fascinating is I don't know that people thought immediately about their gas and their electric. I mean, I didn't think about that.
Right.
I mean, I thought about, well, purchases that you buy, maybe that will matter. Transport, things, but I didn't even think of electric and gas bills and whether that would make a big difference.
Well, that's the way it is with utilities. Sometimes we're just not thought of that much, and that's not the worst thing in some respects.
All right, overall, and I'm going to let you go.
Sure.
I'll put you on the spot. Given the winter that we've had, are consumers seeing larger than higher gas and electric bills just because it seems like it's so cold? I can't.
Well, yeah, it still didn't warm up as we're talking here too much.
Springtime, you wouldn't know it,
It's officially
right?
spring. It doesn't feel much like it. But, energy prices, Terry, as I think I've said to you a lot of times, they're hard to predict. There's a lot of factors that go into it. But, yeah, we did have a real cold snap back in January. And that tends to put stresses on the infrastructure, particularly with natural gas. It's hard to get it everywhere where we need it throughout the state, and it's tough siting gas transmission lines. It's a big political controversy.
I fibbed. I said it was going to be the last question, but it's not.
All right.
Natural gas seems to be a huge factor in the economy of the state. The Wolf administration, Democrats seem to be more concerned about it than Republicans. I'm not saying Republicans aren't concerned, but politically, on some would like to hold it completely. Others say let's regulate it more. Wolf administration doing a little bit more there, but the production is still up. It's still booming in the state.
Yes.
Isn't that correct?
Absolutely. Yes.
Yeah. All right. I just wanted to get that in before we let you go. All right, coming up, we're going to get into a couple of aspects of healthcare that you might not think about. Obviously, you should do your yearly checkup with your physician and make sure you see a doctor when need be, but there's something called the social determinants of health. This is pretty important, and it's something you ought to know. And Dr. Theodore Christopher, he's the president of the Pennsylvania Medical Society. He's coming on, and he'll help us understand all of that and more, and we'll do that after we pay some bills.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties. representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Well, Dr. Theodore Christopher joins me. He's the president of Pennsylvania Medical Society. He's in his real career as an emergency, physician, emergency room. These folks matter, let me tell you. You matter a great deal when there's an accident and people come in to see you. Save an awful lot of lives. Great work. All right, there's something that I don't think a lot of us realize or pay much attention to in our health. We've done so more, I think, lately than we used to. And it has a complicated way to getting into it. The social determinants of health. Translation, there are factors that we're born with, that we live, that are part of our environment, our regular environment in which we live in. They're part of growth patterns that have a lot to do with health, not just something, why does something occur, like cancer or heart attack? I mean, you take it, you're the expert.
Well, first of all, thanks for having me on, and you're absolutely right. And this is my platform as the president of the Pennsylvania Medical Society this year, and nothing makes me more passionate than talking about the social determinants of health. So in the past, doctors and hospitals have been in the sickness business. And so if you get sick, we take care of you. And that's about 20% of health. The rest of health is about the social determinants. And so things we're talking about are the social conditions, your environment, your economics. So what are we talking about? About employment. Do you have a job? Do you have transportation? How about funds to buy your medications? How do you eat? How's your nutrition? Do you smoke? Do you do drugs? And so all these environmental things affect your health. And that's what I think medicine has to really kind of get in the forefront and deal with.
Yeah, one of the things that I know a lot of people, my friends that we've talked about this, we're sitting around chatting about it, is hereditary, about what did your parents and your grandparents, what did they pass, when they died, what did they die from? Is it something that you could inherit a tendency for? That's pretty important stuff.
I often say, I think one of the most important things is your genes. You're absolutely right. So what is in your family? If you've got 4 family members who have diabetes, there's a good chance you're going to have diabetes or high blood pressure or heart disease. And so I think the genes are something you really can't do anything about right now. In the future, maybe, but right now you can't do anything about your genes.
Yeah. So I guess, and I do want to talk about a couple of the specific things with opioids and gun safety and prior auth, some other things, but let's continue this because you're a patient out there, and all of us are patients, and you're the doctor, which you are. Is there something that we should be doing proactively in this whole area, like the genetics, like give us an overview. We only have a few minutes. You could probably do this for a day.
I could talk for hours. But and so the important thing is when you get discharged from the hospital or from the emergency department, what is your follow-up? And so we have to be concerned about that. Are you able to get your medications? Yeah. Are you able to get to the doctor's office? Are you able to have a home to go to? Yeah. And these are important things. So what you see the health systems and the hospitals and the doctors not getting involved in is things like housing, investing in housing. So the homeless, I think, population or those who are underinsured.
And do you pay attention to the physician when the doctor tells you these are the 5 things you're supposed to do, and you say, well, I'm only doing 2?
That's but then usually I think there's a reason why you're only doing 2 and why you should be doing 5.
All right, we're going to run. I can tell you are passionate about this, but that's a good thing. Passion is important. All right, we'll be back. We're going to continue this discussion. We have a couple of wrinkles in it we're going to get to.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, the future of long-term care.
All right, welcome back with Dr. Christopher. He's the head of the Pennsylvania Medical Society. All right, give us, you have an example of asthma and give it.
Well, right. So the whole idea about social determinants is you're reaching out to the communities,
right,
and you're using, it's a team approach. This is a team sport, so you really have to use a team. It's doctors, it's case managers, it's social workers. So, and so you're taking care of both populations, right, and communities, and also individuals.
Great point.
And so, for example, if you have an asthmatic, I can see the time in the future where you have a patient who has asthma, and they call the doctor and they say, I'm short of breath. And the doctor, rather than just saying, oh, okay, take this kind of medication or take this new medication, they may check the pollen count of the community. And if the pollen count is high, then that's probably most important as to why they're short of breath.
They may tell you have to move, but that's another move to another part.
That's true.
All right, I want to talk about another aspect of it is gun safety. How relevant is that?
Well, you know, it's all over the news. It's certainly on the minds of the Pennsylvania Medical Society. I think gun safety is paramount. I think we have to keep our schools safe, our kids safe. Yeah. We have to keep our citizens safe. And so I'm not talking about the Second Amendment. That's certainly fine. Sure. I agree with that. Sure. But there has to be limits.
I got it. Now, one other one, this huge increase in opioids. Pennsylvania, by the way, is a state that has a huge proportion of people who die from opioids. Doctors and prescriptions, that's been in the news. What's the latest?
So it's probably the most important social determinant right now, I think. I think our deaths, I think it's just starting to come down now, I think, at least in the Philadelphia region, but across the state. But there has to be a lot more done. I think there has to be recovery agents and to help our patients who are addicted.
Right. And the physician community is much more acutely aware of it in terms of, I know, look, here's what I've said. Doctors want to, you come in with pain, and what do doctors want to do? They don't want you to leave without some help with the pain. And so, they prescribe things because they want to be helpful, not because, go ahead, you finish where
I think you're absolutely right. I think the education of the physicians as well as the public, I think, is very important. And doctors are just now learning about alternatives to pain management, not just the opioids.
Yeah. All right, before I let you go, we don't have a lot of time. What's prior authorization? Why does that matter to?
So prior authorization, so there's a bill that we hope will, I think, come out soon in our legislature, but it's about, I think, really holding, the insurance companies more accountable so that if they have, or if there is an experimental drug or medication or procedure that has to be approved by the insurance companies, that they do it in a timely manner, and that they are very transparent about the criteria that they use to approve these things.
All right,
so
listen,
that's out there.
When next time you come back, can we get into this in a little greater detail? I think this is an important subject to understand because of how much prior authorization before you can get a treatment.
It's very important. It's out there. It's happening across the country, not just Pennsylvania, so it's a major issue for insurance companies.
We've talked a bit about it before, but I think that's important. I want to thank you for coming. I know you come from Philadelphia, where we tape in Harrisburg. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.